Hello, hello. Welcome back to the Resting Stitch Trace podcast. We are back today with another episode with a very special guest who Dr. Erin would love to introduce.
This is Dr. Amber Collins. She is a professor at Rocky Mountain University. She has a background with her master's degree in education and counseling, as well as a PhD in health science with an emphasis in healthcare administration and leadership. But the most important part of her background is that she is my identical twin sister. I am really excited to talk to her today. I think Sarah's maybe feeling a little
Intimidated.
confused to talk to her today.
So, welcome, Amber. We're really excited to have you here. It's really funny if anybody's watching. It's like double trouble. It's kind of funny. Because they look alike, they sound alike, they laugh alike. And so getting started, Amber, tell me a little bit about yourself because I know a little bit about you from what Erin has told me, but we haven't done like a deep dive. So can you give me a little bit of your background and how you got to where you are
Yeah,
now?
well, I'm glad to be here. And I think I'll start out by just saying it's really weird growing up as an identical twin, where it's just like your whole identity. That's all anyone thinks about. They can't distinguish you. And then you grow up and move across the nation from each other. And then suddenly there's people that don't even know that you're a twin. So, kind of funny getting back on a platform where we can talk and be just alike in so many ways, but I'm excited to be here. I've been working in higher education for about 18 years now. I started out as a career counselor. So my focus was helping people get jobs and internships and things like that. And then I shifted where I was still doing that, but just with a different focus. So I was a pre health advisor. So I was helping people get into dental school and medical school, PA school, a bunch of different health professions. And then after doing that for several years, and now I'm an administrator at a PA school. So graduate level education, medical training, and I'm not a PA. So a lot of people are really surprised that a PA program would let me in. But I've been able to bring all of that professional focus and career coaching to help my students be able to develop as professionals. And so that's a lot of the things that I focus on as a faculty member is professional development, including emotional intelligence and kind of the art of medicine beyond just learning the science. How do we refine that so you can actually connect with patients and do a good job and not be that doctor that's off-putting or rude? We've all been to someone as a provider that we just leave thinking, oh, I didn't like that person. So our goal is to help turn them into the type of PA that anyone would want to send their mom or their grandma or even go to themselves.
We didn't have anything like that in our training. Oh my gosh. I'm like, is a thing that exists? Wow.
I don't know if it exists everywhere, but that's one of the really great things about our PA program.
I
Just
love
put a
that.
plug out there. So we have a professional development class that our students take every single semester. So it's just a curriculum that's built in that helps focus in on those themes that really hopefully will make them a well-rounded provider and not just a scientist.
So
Yeah,
when
I
Erin said that you were the one that suggested maybe she go to dental school and become a dentist, like now I'm like, I get it. I understand. Was that your first push for somebody
No.
to go into the health professions or had you already been
Well,
at this for a while?
that's really funny because I never thought I would be in the career that I like. This path was not expected. So yes, she was my first, but that
Love
wasn't
it.
even on my radar back
she's
then.
a really good advisor and career counselor for
That's
anyone who
just who
needs
I
some
am,
help.
I guess,
Look how far I've
Start.
come because of her.
That's right.
Yeah, so funny.
So I love what you said, Sarah. This seems so foreign to us, and maybe we've been out for a little while. Maybe they are picking up some of these soft skills a little bit more. But my sense would be not maybe so much in maybe the medical, dental, surgical side. And I do think it's really important. And I think we've all seen those instances where, for example, the people like the number one and two people in our class, of course, got accepted into residency. And were they the favorite residents? Kind of not sometimes because, yeah, maybe they're amazing test takers, but that doesn't always translate into good patient care. Maybe their surgical skills are great or their clinical skills are great, but their ability to have compassion and take care of patients is different. So, what do you think it would look like if emotional intelligence were treated like a clinical skill? How would the training be different? How would that look?
Is that a question for me or for Amber?
Well, I
'Cause I'm
guess
like, I don't know.
either, but I was aiming towards Amber, but I'd love to hear
Perfect.
Sarah's take as well.
Well, I think I always go back to I'm not a provider of any kind. I'm not a surgeon. I'm not a PA. And so I often just think about my own interactions with going to a medical provider of any kind. And I dread it almost all the time. I dread it. Oh, I hate going to the doctor. And then I think, well, isn't that kind of weird that that's the profession I'm in, training medical providers? But then maybe that's not by chance. Maybe that's why I'm so passionate about this concept is helping people connect better with patients so that it's not just, oh, I'm some expert, listen to me and, just trust that everything's going to go well.
If it was treated like a clinical skill, like if it was treated like, here's how you make an incision, here's how you hold the 15 blade, here's how you interact with patients. Clinical skill, do you think that the outlook that you have when going to the doctor, do you think that the outlook
Mhm.
in medicine in general would look different? And do you think training would look different?
I think probably training would look different, but I think it would start different. It would start earlier on with more the admissions perspective and in medical and dental admissions. I think that everyone's trying to find that person. There's a lot of little tricks that schools are trying. Let's try this kind of interview format. Let's try this kind of an essay to try to hone in and get that person. I mean, sometimes it works really well and I'm part of the admissions for our program, and we find really amazing students that we admit. But every once in a while, you get someone that slips through the cracks, and you're like, oh, how did we miss that? They're not living up to what we thought. So I think a lot of it starts how do we even hone in on choosing the right people? But I think the other part of it is humility. It's the idea of looking at some self awareness. If you don't have self awareness, I'm not sure that there's anywhere for the growth to occur. And I do get students unfortunately who will even be like, "Why are we working on emotional intelligence? Aren't we already emotionally intelligent as it is?" And I kind of laugh at that because it seems a little ironic to say that. But a lot of it is we have to be aware that no matter where we're at, we need to look for ways to improve.
Sarah, can you imagine having these kind of curriculum topics in residency?
I think it's interesting simply because I think that Amber's right. It almost begins before you get there. I think it's something that can be taught, but I also think having gone through residency, I watched other providers like my senior residents and even other dental students and my even attendings. I watched their interactions with patients and you could and watch the reaction of the patient, and that was my education in that
Mhm.
way. Like, how can I better communicate with the patients? How can I, uh, portray this information that is acceptable and that they come out understanding as opposed to with more questions and with a negative outlook. That's how I had it in my curriculum. Not it wasn't necessarily as a checkbox for anybody else, but it really taught me a lot watching other people because you learn from everybody.
No, I think that has two requirements. What Amber said, you have to be self-aware enough and even paying attention that you are trying
Mhm.
to pick up on that. And then the other part would be that you have people to model that are worth modeling after.
Right, but they
So
sometimes say like the best like a lot of times what you learn is what not to do.
that's
Mhm.
true. And I think we all had people to learn from like that.
That's true.
Well, and I was going to say, Sarah, that I think the things you're talking about are forms of emotional intelligence in itself. They're just having that self awareness and that proactivity and like, realizing that I think there's one thing to, it's important, especially for surgeons to have confidence. The last thing that a patient wants is to be like, oh no, I sure hope I can do that. Sometimes even faking the confidence is appropriate, but not to the point where you come in thinking, oh, I know everything. I'm already the best. I can't take anything from this person I'm interacting with. But rather than
Right.
saying, even if someone isn't a doctor, maybe can I learn something from my patient? I think that's part of emotional intelligence as well.
Oh, I had, a co-resident that I worked with, and I really could tell just a super smart guy and a really nice guy. I really enjoyed working with him, but when we would go into a room, I could tell that he was talking at the patient.
Mm,
He was trying to be very efficient with his time. He was talking at the patient, and I could see on the patient's face that they felt like they were being attacked almost. Not
mhm,
that's not the right word, but you know what I'm saying? It was just like they were being force-fed information and not given enough time and opportunity to process it and
mhm,
consider it before he was like, "Okay, bye." And then on the alternative, I had a surgeon that, when I had my knee surgery, and he would talk and talk, and then he'd continuously ask, "Do you have any questions? Do you have any questions? Do you have any questions?" But it wasn't an invitation. It
mhm.
was because he was taught that he should ask if they have any questions. So I think that
Yeah.
that's where that little bit of self-awareness goes a long way.
This leads into a question that I have, and Amber was kind of alluding to. I think a lot of times when we're choosing people for programs or for admission spots or for jobs, we're trying to choose the person that already has that emotional intelligence. And I
Mhm,
think when you talk about emotional intelligence, to me, that sounds like this innate thing. Like we all have our level of intelligence that we are born with, and maybe we can cultivate that a little bit, but there's some genetic or environmental component to it. So, Amber, can you tell us what actually is emotional intelligence? Is that something that we just have? Is it something that we learn? Is it something that we can get better at? What can you tell us about that? I also want to say too, I find the people that say that they have the people that brag about having emotional
mhm.
intelligence usually are the ones that I feel like, really? So
Yeah.
is that part of it too? Have you found that to be true?
I love that question because, yeah, I think someone with emotional intelligence or strong emotional intelligence can certainly have some bragging rights, but I think most people who do have enough emotional savvy not to go around doing that, right? But the study of emotional intelligence has progressed over the years. I think it started with IQ. We've heard about IQ. Oh, this person's so smart, their intelligence. And I think at the core of what happened is that psychologists started noticing, okay, but these people are really smart, but something's sometimes missing. How is it that someone who is so smart maybe isn't as successful as someone who doesn't have that same level of intelligence? What's going on there? And so that's where psychology started delving into the idea of the EQ, emotional quotient, that other side of things, where it kind of focuses on your psychology or psychological well-being. You know, at its core, it's your ability to kind of cope with challenges that come your way, and it speaks to your resilience. Like, do you have positive coping mechanisms when things get hard? Because we all know life is always hard. There's always going to be something coming at us. So, how are we coping with those things? How are we approaching them? Do we have a bad attitude about it? Are we pessimistic? Or can we have a positive attitude and some optimism? I can get through this. We can deal with this. More of a problem solving approach. And then realizing that we do have kind of some internal capacity or control. You know, we can't control everything around us, but we do have the internal capacity to influence other people and to influence situations. And I think that's what emotional intelligence is to me, is just those internal capacity or skills that we have. And I like the word skill because it's not a personality trait. It's not our intelligence. It's actually what skills are we utilizing and how well are we utilizing them. And sometimes we underutilize skills, and sometimes maybe we even overutilize skills. So, one component of emotional intelligence is assertiveness, for example. And so, a lot of the time with emotional intelligence, and my students will look at it and we'll have them take an assessment. We'll give them a score, and they'll say, "Oh my gosh, my score went up." That's always good. And yeah, it's good, but also we're looking for balance because I think we know people who maybe overutilize assertiveness. We have a couple people maybe in our mind that we've interacted with that are sometimes kind of aggressively assertive, right? And so sometimes it's more about balance than being really high in this area because, yeah, you might be really assertive, but maybe you have low empathy. And so, how does that assertiveness actually like come across?
So do you think, because Erin was asking, do you think that there's a way to sort of hone those skills in a way that can really build when the balance is off, for example, like can you build up the other side of the scale to really get the balance more favorable?
Yeah, the great thing about emotional intelligence is because it is made up of like skills that you can be coached on them and you can practice them and you can get better. We're each a work in progress. And so, again, if we go back to that like core foundation of some self awareness, if we know that there's an area of our emotional intelligence that we're just not utilizing as well, we can practice it. We can read books, we can journal, we can pay attention to how did it go today, and we can grow little by little. I don't think it's very reasonable for us to expect any of us to expect that, oh, I'm really bad at something and by tomorrow I'm just going to suddenly be good at it, but it certainly is something that someone can work on. Whereas IQ, I think you can study and learn, but how much study and learning does it take to have a statistically significant impact or change on IQ? I just don't think it happens very well.
So you
Do you
mentioned journaling. Can you give us an example prompts that journaling can help with, like some small little tasks, daily things that you could do?
Well, I love journaling as well as speaking out loud. So I think both can be very powerful. I'm the type of person where I often don't really understand how I'm processing something or feeling about something till I get it out, whether it's on paper or I talk to someone. And I think that's common. I think that's why a lot of people like therapy. You don't have to have a therapist to be able to process your thoughts. And so I think a lot of it will depend on what you're working on, what you'd like to work on. And I think a lot of it comes down to just even saying, what did it look like today? I think you really need to hone in on probably one or two of the emotional intelligence skills that you'd like to work on. I don't think we need to overwhelm ourselves and say, oh, I have to fix everything, I have to work on everything. But maybe what's one or two areas that I'd like to improve on? Let's talk more about assertiveness. And so with journaling, you can reflect back on your day and say, how did that go? Did I have an opportunity to be assertive today and I missed it? And if that's the case, why? Or did I have an opportunity to be assertive and I went for it? And what went well? And what can I practice and maybe do a little bit differently? I think we can also ask ourselves, what holds us back? Why do I not want to be assertive? And I think there's often this idea too that there's this right or wrong. Everyone should always be assertive. But I don't believe in that. I think there are opportunities where if you're assertive, then you could put yourself in physical or psychological or emotional danger. And so I think a lot of it is analyzing that too to say, was that was that an appropriate decision not to be assertive? Because it
Yeah. With that, Erin, how do you feel about that comment as it pertains to our training as surgeons, as dentists, as how do you feel like that comment sort of fits with how our training went?
the comment about assertiveness, or what do you mean
About how
specifically?
you don't always have to be assertive.
Oh, yeah, we get that pretty good in residence. We learn to be pretty assertive, which although
It's
part
a
of it
dog
is
eat dog world out there.
it comes in both directions too, though, like not being assertive and standing up for yourself or your own wellness. You're not really allowed to do that as resident. I always say it's like, "Can I have some more, sir? Like, give me some more gruel or some abuse."
Yes.
Mhm.
But I want to ask you, Amber, as you're talking about this self-awareness and how important that is, I'm trying to go through the checklist in my head of like, okay, let's be self-aware. What kind of emotional intelligence do I have? And I'm coming up a little short. Do you have a list of things that we can self-assess? And
Yes,
what
thank
kind
you.
of common things are you seeing with your students that maybe are problematic in
Mhm.
healthcare providers, doctors, etc.? Are you seeing common deficiencies and spots we should be especially attuned to? Because I think self-awareness might be a big one that we're missing out.
That actually is part of the model. So I think with emotional intelligence, if someone really wanted to say, hey, where am I with this? I think the easiest thing to do is go find an emotional intelligence model. Like Google it, go online, see what model that you're interested in. There's a couple. The one that I'm certified in is called the EQI 2.0 model, and it has 5 realms of emotional intelligence. And then each of those realms has 3 subscales. So there's 15 total subskills.
Can you tell us what they are?
I can definitely tell you what they are.
Yes.
I'm going to have to read them because I don't have them all memorized. All together, they make up well being. So the assessment, the EQI 2.0 that I have my students take, will actually give them a wellness score. It says when you pull
So
all these together,
it
here's your
shows.
wellness. Yeah.
So EQ, emotional intelligence, this isn't just about like having patients like you. This is about like your own wellness, your own satisfaction and ability to maneuver in the
Yeah.
world. Is that correct?
Absolutely. And that's what I love about EQI and teaching future medical providers is that, yeah, this is ultimately at school. We're teaching this so that you can interact better with patients and offer better patient care. But this is everyday life. This is with your partner, with your kids, with your neighbor, with your colleagues. It's not just at work or with patients. And so, what I do really love about the EQ 2.0 model is that it all comes together as a core, all the 15 sub skills to suggest what your well being score is. So, it's also saying, here's how you feel about yourself and your optimism and your approach to the world. And I think that's also helpful to say, are you doing okay? And it's not a set thing either. You could take this, and then we actually have our students take this assessment at the beginning of their coursework. And then we have them take it right before graduation. And we say, what changed? What improvements? Or maybe there's things that you didn't improve on. Sometimes their well being score goes down because school is hard
Mhm.
and patient care is hard. And that's okay. But maybe it's a good place for us to pause and say, I wonder what's going on where my well being score went down. And if this is a career that I'm devoting my life to, what can I do differently? So the grind, the burnout that's so common in healthcare among all the professions, how do I figure out how to make this work so I'm not unhappy? Right. So delving into the 5 main areas of this model would be self-perception, self-expression, interpersonal, kind of like relationships, decision making, and stress management. And those are the things that we're focusing on. So, how are you perceiving yourself and the world and how it fits into the world? That includes self regard. How do I feel about myself? Is that a fair assessment? Your self actualization, which is that's probably the trickiest word. People are like, what does that mean? That's like goal setting. Am I trying to improve? Am I looking for opportunities to grow? Then your emotional self awareness. Am I aware of the things that I'm feeling? Self expression is made up of emotional expression, assertiveness, and independence. And I love that independence is in there. When I first heard this model, I was like, well, that's kind of weird. Self expression is independence, but it's that ability to be able to make decisions. And it's not just, oh, I'm a lone wolf and I don't care what people say, but it's finding that balance. Are you someone that can go out and seek out advice in an appropriate way? But then you can also make your own decisions. You're not under dependent or over dependent on people. Interpersonal is built on interpersonal relationships, empathy, and social responsibility. Decision making includes your ability to solve problems, reality testing. I love that one. Are you seeing the world the way it really is? You know, can
Mm.
you look at things realistically? And it also includes impulse control, which I also really love because I think that's difficult for some people. Maybe they're really great at some of these other things, but impulse control can kind of get in the way. And then the stress management is flexibility, tolerance, and my favorite part of that is optimism. When's the last time you thought about optimism as part of stress management? Not something that's usually been on my radar, but I think that's really powerful.
That's a lot to unpack.
It's a lot. It's a lot. It's easier if you
Wow.
can see the model, and read it.
Yeah.
That's a lot to remember, but there's some really good stuff on here. And that's where I was saying I wouldn't expect anyone to look at this and be like, "Oh, I've got a lot to work on." We all do. And I think that's where maybe focusing on one or two things. I've been practicing assertiveness lately, and that's why it keeps coming up probably because it's on my mind. But maybe you're saying I'd really like to improve my assertiveness and maybe my optimism. I think that's a lot more palatable and a lot less overwhelming where you just say, "Oh, screw it, I'm done. This is too much."
Yeah.
Just focusing on something simple.
Great for you. So, I so me, Sarah, I have often found that people say things that they see in me, and I don't see those things in myself. So when you're talking about optimism, I think that
Hmm.
when people talk to me, they feel that I'm very optimistic, or they feel that I'm very driven and motivated. And on the inside, I feel like pessimistic and like a big scraggly mark. I've called it like firework spaghetti. And so it's like, it's a very interesting thing that, like, when you say self actualization or
Hmm.
realization, is that what it was? That
Maybe even
like,
self regard.
what is reality? I'm like, I
Oh,
don't
yeah,
know
yeah.
what reality is because my reality seems very different than the way that people perceive me. You know what I mean? And so, and then how does that play into burnout, right? Because
Hmm.
then is it that am I playing a role and I just don't realize it? Or is that actually who I am? You don't always express all the things, even though you can always see it in my face. But like, how, I don't know, like this, like burnout, burnout, burnout. That's like the word that keeps flashing in front of my eyes as we're
Yeah.
talking about this.
You're very existential. I love it. This is so deep. And I can't say I'm any kind of expert on that. And it's been a long time since I've had an official counselor role, which that reminds me of. But I really love your focus pointing to burnout because isn't that really probably the biggest barrier to good patient care? Because we see so many people, and I've seen so many students, please, I want to go into this profession and I care so much. And then by the time they get out of their training, they're already jaded, they're already burned out. They're starting out their profession at that deficit to the point where maybe they're low empathy at this point where they started out that way, they're low social responsibility, they're just depleted. And I don't know the solution to that. If you're starting out already burned out, it's that idea to me of if your bucket's empty, everything else left to give, right?
Yeah.
So I
Is
think
this a
that
new
is like,
phenomenon, do you think, or has it always kind of been this way?
I would guess that it's not new, but I think it's getting worse.
Okay.
Because I think that more and more is expected of healthcare providers. The productivity is such a focus. See more
Hmm.
patients, fit in more, make do with less. Now, oh, you're finally doing so well with that. You've seen 20 patients in a day. Let's bump it up to 22. Oh, great. Now you can see 22 patients in a day. Like, certainly you can do 25. So I think even if people or providers have the best intent,
Hmm.
you're battling that burnout and just like you said before, colleagues, like, I don't have enough time to have a good solid conversation with the patient that shows all this emotional intelligence that you probably have. I don't know the solution. I think there's a lot of things broken with healthcare and I don't know how to fix it. But it maybe conversations like this do. But let's get back to what you were saying. Isn't that so common for each of us to have some self beliefs about ourselves that don't match what other people say about us? And in our emotional intelligence unit, one of my favorite exercises is during class, I'll have my students, okay, let's write down some of your thoughts about your strengths and your weaknesses. Let's get them out on paper. Think about it for a minute. And then I say, I want you to choose at least 5 people who are close to you, and I want you to text them right now. In class, it's allowed. It's allowed in class to like text people right here and now. And I want you to ask them, what do you think are some of my core strengths and weaknesses? And I love that exercise because, usually the people that are close to them are kind and sensitive and tactful in this exercise where they'll say, I really appreciate this about you, but I also notice maybe you're hard on yourself or maybe this. And the students usually come back saying, oh, I was surprised. Like, I'm way harder on myself than any of these people were on me. And I think that's so common. I don't think that it's unfair for me to say too that I think maybe women deal with that a lot more than men. Just this confidence issue. So self-regard, I think, or self-actualization or reality testing, really they all just kind of go hand in hand,
Yeah, I see that.
you know.
I do. I do.
But I think maybe in someone like your case, the self regard, that's the other cool thing about this model when we talk about balance is that, we talked about earlier, like assertiveness. You're like way high on assertiveness, but maybe low on empathy. Maybe that can cause you some trouble. But also, you can use your other strengths and emotional intelligence to bolster areas of weakness. And so maybe you are good at reality testing, but self regard, not so much. Could you not use reality testing if you're good at it to then say, how can I work on my self regard? How can
I
I
like
have a
that.
little bit more honesty in how I'm looking at myself?
I don't think you're
Interesting.
an imposter, Sarah.
Well,
The syndrome is
is the
large,
jury
then
out?
she
I think sometimes too, like we are hard on ourselves. And so, like, I am the type, I look at you and you're like a ray of sunshine. And that's how I think of you.
Oh,
But
thanks.
I don't know, Amber. Yeah. I don't know like all the hard thoughts you have in your mind, but that's like, I feel like that's who you are to the core. And we can all
Mhm.
sense that because that's who you are. And it's different enough from other people that like radiates to us. But just because
Mhm,
you have like hard times, or I think the burnout does kind of you're seeing that right now. Maybe it's a hard
Mhm.
time you're going through. Maybe
mhm,
it's a depth of depression. Maybe there's grief or something that's kind of like making that harder, but doesn't mean it's not like who you are as a person inside. And
Mhm.
so you're not an imposter. We just see that. It's like even if maybe you're such a ray of sunshine, maybe you're like 100 and the rest of us are 40. So maybe you're dim right now. Maybe you're 60, but you're still higher than the
mhm,
rest of us anyway.
mhm.
Thanks,
I
Erin.
love the way you said that. That's
Yeah, that was
powerful.
beautiful. Yeah,
I
thank
think
you.
good. Yes, full of wisdom over here. I was thinking kind of similar thing. I think the self-comparison and stuff is such a big part of that. I just got back from our annual association meeting, and then I went to this social media conference that was really interesting for doctors. And I was trying really hard to navigate my personal feelings, like, who am I? Because in one way, I know I'm going to this social media conference and I know there's people there that have like millions of followers and hundreds of millions of
Mhm,
views, and they're making literally millions of dollars on social media. And so I'm feeling kind of leading up to this, like, I'm a nobody. Like I made $200 on TikTok last month and after years, and I've made hundreds of videos and still don't have any followers. And I'm kind of embarrassed. But I kept running into people that were like, oh, hey, Erin. And I'd be like, do I know you? And they're like, oh, I follow you. And everyone knows you. Come on, you're famous. And I'm like, I don't know a single person in this room, but I'm glad you think I do. And then
mhm,
when I was actually at this influencers event, again, feeling kind of like, oh, small potatoes. I have like 20,000 followers across platforms, which sounds a lot better than when you see like 5,000 on Instagram or
Or my
however here.
250.
But all these people were like, oh my gosh, that's so inspiring. Wow, you're big time. And I'm like, I am? No, I am. And they're like, I only have 80 followers. So it's really easy to define who we are based on other people. And we can't always find someone else who's doing less or someone else is doing more. I'm
mhm,
suspecting a big part of that emotional intelligence is just finding your own light and not getting too
Oh.
swayed one way or the other. But that's kind of what I was thinking about, maybe in a different way, Sarah, but just not knowing how other people see you is
Mhm.
hard sometimes. And I try not to let how other people see me affect me too much. But
It always does.
sometimes when we're hard on ourselves, I think most of the time people see us more favorably than we suspect.
I always like that mantra of like, what is it? What someone thinks about you isn't your business. You know,
Oh, I
I
love
really
that
like
too.
Oh,
that,
Yeah.
that's my mantra. I probably told it to you 10,000 times, so that's why it's none of
but
my
I just
business what
like,
anyone else thinks
you
about
know,
me.
but I'm not there yet. Yeah, I don't know if I'll ever be
Yeah.
quite there yet, but I think a lot of this just gets back to the point of I think we're all doing the best we can. And if we have that growth mindset, it doesn't mean I am who I am and that's it. I think the idea is that why don't we just try to refine ourselves just a little bit
Yeah.
each day, one little thing every day. And I like the awareness of, you know, if you were to take an EQ assessment and even just get it kind of down on paper and see what it says about you, I think it can really help shape or be like a roadmap to what are your next goals. You know, how can you do something a little bit differently than, and maybe you didn't even realize it was an area that you could work on.
Yeah. Can we talk about kind of the stress management piece of it?
And where else
I
begin?
think being a surgeon, it can be high stress. We have high stakes decisions to make
Mhm.
sometimes. Sometimes we have to make them in the instant. Sometimes things aren't going how we expect. Can you talk about some strategies when maybe we are feeling personally triggered or having that stressful moment, but we still have to lead the team? We still have to save
Mhm.
the patient or help the patient or, perform the procedure, et cetera, when you're feeling a little bit of lack.
I think with stress management, I think it comes down to utilizing your strengths in other areas. I think that it's really easy when we're stressed out or we notice the emotions are kind of taking over. We're not maybe processing things as well. We're not controlling ourselves as well. A lot of it is being able to say, okay, I'm feeling kind of overwhelmed right now. What can I draw from that's going to help me compensate for how I'm doing in this area? I know for me, you know, I'm a pretty sleepy person, and when I'm sleepy, I tend to be a little more intense with my kids. You know, I might yell more than I normally do, and you know that's not life and death like a surgeon. But my point is, you know, if you can recognize kind of what happens, you start seeing your triggers like, oh, I see myself getting on this path. Then you can look at it and say, okay, maybe I'm not able to control maybe my emotions as well when I'm at deficit like this, but I do really care about people. I do have strong empathy. I'm good at that. And so if I can just remember that at my core, empathy is really important to me, caring about other people is really important to me, maybe it can help me just slow down and reframe how I'm talking to my kids. And I think the other part of that is also boundaries. There's some tricky situations that I don't know because I'm not a surgeon, but it might be better for you to just go take a 5-minute break before you start surgery or encounter something really hard and stressful, just to give yourself a physical break so that at least your physiology can kind of catch up or you're not feeling the cortisol and the adrenaline and some of the intense things that can kind of take over our rational brains to help us process through things. And then asking for help. How common is it, especially if you are in a leadership role, to think that I have to fake it, I have to like, be stoic, like no one can know? But I think a lot of people who are, I don't always like the word subordinates, but people who are a part of your team that are following, I think it's actually really refreshing to see the human side of a leader, to even just say, I'm glad they said they need help, but you know what? I can do this little bit. It'll just make it a little bit easier.
Yeah, I think that that is really important. And I've seen that in practice because it goes from the micromanaging sort of feeling to being empowered, right? So when there is that expression of human like character, right? Where you're like, I need a break, just a few minutes, your staff and the people that work with you are, I think, very happy to acknowledge
Mhm.
because otherwise they feel like they're always kind of holding things together
Yeah.
in those situations. And they're like, okay, we can all take a collective deep breath and like, it's okay. Let me go talk with this patient and keep them occupied so that they're not worried that they've been sitting and waiting for so long because I know that we'll all be better for it. And so it gives them, empowers them to have that space to make the situation better, which I think is really cool.
One thing I've been trying to do is pay attention to my triggers, and I've learned that anger, well, a lot of times we're uncomfortable with anger. For me, anger is a really good dog whistle to me. Like, okay, you're being triggered, because that's when I get angry. One of my biggest triggers, I decided at work, this happens somewhat frequently, which is kind of embarrassing to admit. But I'm like, oh, even kill with patients. I would never like raise my voice or anything with patients, but like if someone will come in and be like, this patient came 35 minutes late and the clerk said you'd go ahead and see him, and they're like in a room and you're seeing him next, even though like other people are waiting, stuff like that. I'll just be like, oh, what do you mean? It's a 15-minute window. Why are there, that will be my tone of voice, and I don't like that I'm raising my voice, etc. But I'm really learning. I really don't like when people just assume things and don't appreciate me, and they just decide I'm going to do something, or like the ER comes and I'm not on call and they're like, thanks for coming in, bye. And I'll be like, what the heck? I want to be consulted. I want to be asked, and I'm a bleeding heart, and I probably will be like, okay, we'll do it. But the moment before, I'm like, I can't believe it. I'm so annoyed that they just think they could come in, they can march in here and do whatever they want, and they think I'm going to see him. And then I'll go in and be like, oh, you're having pain. Of course I'll see you. I'll help you. And then I'm like embarrassed that I had to have that emotional tirade. The end result was the same. Like, saw the patient, I wanted to help them, but
I think
this is
I
a
have
thing
the
that I see
same.
frequently. Is it not
I'm
just
the
me?
same. And what I realized about myself was that it's a control issue. And I've already decided that that patient's not showing up because it's already been 15 minutes. And so then
Yes.
I'm like, oh, I get a little
No,
bit of a
that's what
break.
it's the
And then,
disappointment.
yes.
It's
And
the
then it's
having to
not,
face more work
mhm.
on top of everything, and now
Yes,
you're
and now
behind,
everything's
and
crunched.
yes.
Yes, and that's what it is for me. And so it's almost like we just have to set those boundaries. It's 15 minutes. And after that, we'll try very hard to see you. Here's the probability that you're going to be able to be seen in the next 2 hours. I don't know.
Sure.
Let me go ask Dr. Sheffield. Let me see what she has
Right.
to say about that. You know what I mean? I think that you've got to empower your staff to have those
Yeah.
conversations because people know that they're late. If they show up late to their hair appointment, to their massage, they don't get quite the same treatment and they still have to pay
Yeah.
for it. So
Yeah.
people know.
Yeah, that's helpful. And so I think you're exactly right. Once you can identify, this is when I get mad and this is when I lose my cool, and it's because this is happening and it's a pattern, then you can set up those systems, or you can set up that mindset change. You can coach yourself, or you can coach your staff on how to approach you. You better bring me a coffee and a donut and ask me sweetly. Otherwise, you're going to get the rant and the tirade.
It's so important to realize that they're just the messenger as well. They're trying to
Yes.
help you and they're trying to help the patient. And so it's like, I really need to see this from everybody's side. Like, I am mad right now because my day's just been thrown for a loop. But it's also like, I know that I'm asking my patients or my staff to do a lot because they're front facing with the patients and with the
Yes.
community, and they're just trying to do the best they can,
Oh, definitely.
So
Definitely. So is
Well, and I
that
really
good emotional intelligence, Amber, that we're recognizing and we're trying to
absolutely.
fix things?
I think that's the whole point. The entire point is being able to just take a pause, say, what could I do differently? I really like what you said about anger, like recognizing the anger is a trigger for other things. I think you said it was like a dog whistle, like you're noticing something. And I always have a conflict management expert come and speak to my students. Her name's Dr. Emily Taylor, and she's fantastic. And I this is something I remember from her. And I don't think it's something she came up with, so I can't give it credit to like the main person, but she just says that anger is like an alarm for like an unmet need. And I love that so much. It's like if you can notice you're having anger, it's not about the patient, it's not about this or that. There's something deeper going on, like you were saying. I can finally kind of dig down, realize it's about lack of control, or it's about like people trying to impose things on me that I'm not ready to take on. I think that's really powerful. So I think that's the entire point here is,
Mhm.
being able to look at that and say, okay, I'm noticing some things about myself. What could I do just a little bit differently and a little bit better? And then also the other thing I was thinking too about asking for help or like, things that often like in a business world we talk about to be a professional, you have to be this way and to be the boss, you have to put on this kind of a face. I think a lot of that is really kind of male facing or like we've
And masculine,
defined
yes.
professionalism based off of that male history of men being in charge. And I think there are a lot of things that women or, in general, women offer that are really powerful for leadership and I think women can be role models to also men as well. Of like, it's okay for professionals and for leaders to be able to ask for help. I also believe that it's okay for professionals to cry sometimes.
Thank you for saying that.
We cry all the
We
time.
do. Oh my gosh. And that's a big discussion, right? Like, is it okay to cry with your
Yeah.
patient? Like, you've just delivered bad news. Is it okay? And somebody posted this. Is it okay to cry? And I'm like, of course it's okay to cry. What a silly question. But then all of the responses come pouring in. And so many people were like, no, it's not okay. You're just there to deliver the information and you shouldn't be emotional about it. I'm like, I don't understand. How is that possible? How do you just deliver bad news and not feel it? You know?
Well, from the counseling perspective, I think there's a good time and place. Like if you're someone who's crying every single time, then maybe you look at yourself and say, am I like not having good boundaries? Am I internalizing some of this stuff too much where I can't separate my professional life and like interacting with patients? Like, am I going home and like bawling all night long because I dealt with something? And, I don't think that's healthy because you're going to again get more burnout if that's your
Mhm.
reaction. But also like in counseling we talk about just being genuine and real, and there is some power to if you genuinely feel that emotion. I think it's okay and has a time and place, to actually show this is really hard and I'm having true empathy for you, which means that we're here crying together. I think it can be powerful. And again, if you're doing it all the time, then maybe
Right.
maybe you
Right.
need
No,
to
that makes sense.
scale back. But I think
Yeah.
on an occasional, well-timed, if you feel like the news is tough and you're crying, I don't see why that's a bad thing. As a patient, I would appreciate that.
Yeah. I would too, I think. I have another story for you. You ready? Okay.
I'm ready.
So the other day, I had a patient. I'm not sure that I've ever had this before, but maybe I have. I've chosen to selectively forget that memory. But I had a patient the other day, first thing in the morning, that was in a lot of pain and had gone to see the general dentist first and then had come over to our office. And within like 3 minutes of meeting him, he screamed at me, just screamed
Love
at
that,
me.
huh?
And I was like, do not yell at me. I put my foot down. So then afterwards, I said, we can't accomplish anything if you're not allowing me to, blah, blah, blah. And so I tend to not be like super assertive, but like in those moments I can be. And one of my assistants was like, Dr. Harding, that was like true emotional intelligence. And I was like, whoa, me? Intelligent emotionally? Thanks. And I said, I think it's so funny because what I really realized was him yelling at me. I've been like almost conditioned by my youngest child who screams at me all of the time. But the fact that this older gentleman screamed at me and then I came back with my normal assertive tone, which I do with my child, but then he was an adult and had some self-reflection and I was actually able to have a rational conversation, not just like, I'm just going to burn this
Mhm.
house down, mom. It's like, okay, well, that's not going to work. But I think that that was really eye-opening to me because I never really thought about it as emotional intelligence. I thought about it as
Mhm.
managing my kids, but I'm realizing that having kids have been beneficial in that way of managing patients because at the end of the day, when you're really in pain or really upset or whatever it
Mhm.
is, you react in ways that you wouldn't normally. And I think giving grace
Mhm.
to those situations would have been hard for me in the past. Like, what an asshole, or whatever.
Right.
But I know that he was just like you said, anger is a sign of something deeper, right?
Mhm.
So I thought it was a really interesting encounter and it really like brought it full circle, like around like, oh wow, how are we learning these things? How are
I
we
have
learning this emotional
Mhm.
intelligence?
I have kind of the opposite thought, and I'm admiring
Yes.
you. Like at work, I can keep my cool in almost any instance. It's very rare
Mhm.
that anything
Yeah.
flusters me, and even if someone triggers me and makes me mad, I can maybe be a little more curt than I normally would be, but still, like, very professional, or maybe the patient will go, "Oh, did that kind of maybe make her upset or something?" I would never be
Mhm.
rude or yell or any of that. And then I come home and it's so easy to just be like, "Yeah, yeah, yeah, yeah," at the kids.
Oh, yeah,
And
that's
then
what I
they're
do too,
yelling
don't
at
worry.
each other. And then I'm like, "Where do you learn this from? Why are you always yelling?" But I think about, like, at work, I can keep it in. So I have that capability. It's just at home, maybe it's like I let my guard down, the stakes aren't as high or something, but I think about that, like, you've done it at work, so you can learn to do it at home, and so I'm learning from work to try to be better at home instead of at home being better at work.
Mm.
I'm not learning very well. Amber we'll have to do some private coaching on the side, but
I might have to join in on said coaching, so it's fine.
I think I could talk with Amber and Sarah for a million years, regardless of the topic, but I think we might just have to have you come back and talk some more. I thought it'd be fun to end with a little bit of twin trivia or talk.
Oh,
So,
yeah.
Yes.
Sarah, do you have any questions? Or Amber, do you have any funny things you want to share?
Hmm. I think I told Erin this before, but I was really hoping my first kiddo was twins, and I was, like, almost disappointed that it was a single pregnancy, um, just because I wanted it one and done. But so I'm always so intrigued by twins. Did your mom and dad keep you in classes together all the time, or did they try to separate you and put you in different classes?
Do you want to answer, Amber?
In the beginning, they wanted us to be together. Was it first grade? I think it was first grade where they elementary school had tried to
We
separate us. Maybe it was
Our
second grade.
school had a rule that twins were not allowed to be in the same class, and we
Uh,
really didn't like that. We just changed schools, and we didn't like that, so they requested us to be in the same class. So we were always in the same class through elementary school.
I think
And
in third grade we were finally in a different.
were
Weren't
we?
we in different classes? I thought we were in different. Or fourth grade.
My
Fourth grade
memory is we were always in the same class, maybe.
was really impactful. It made
right.
such a huge difference.
Seems like it, yeah.
I thought we were the same class. Now I'm confused. I don't know. I'll
I
have to
think in
ask
fourth grade
mom.
we had different teachers.
Did we? And then we went to a special school for 5th and
Hmm.
6th grade, so we were in the same class
Yeah.
again. But I've had questions about that because I remember Amber's friend Tisha had twins, and she
Hmm.
separated them, and they seemed like they were really thriving doing their own thing, and they had their own friends, and it seemed kinda cool, and I thought, "Did we miss out? Because I've always wanted to be with her, but maybe that would have been better to build our independence." But then I also have read studies that say it's traumatic to separate twins, especially
Mhm.
identical twins from each
Yeah.
other, so maybe it was the right thing. I always was glad that we were together, but I think that's probably a case by case thing.
Yeah, interesting. Do you
Well,
guys have
speak for
ESP?
yourself.
Do
I
you have
always like to.
ESP? Do you, like,
Uh,
kind of
I feel like there's been a few like weird moments, but I don't know. Maybe when you move like across the country from each
mhm,
other, that
It's
connection
too
gets
far.
a little fuzzy.
mhm,
I would say a lot of it is it's a really unique situation growing up as a twin, especially as identical twin. Like you shared the womb with that person,
Hmm.
and then we shared a room with that person. And that was good,
I see what
wasn't
you did
it?
there.
I was
Yeah, yeah,
laughing at myself as
yeah.
I
It
said
took me
that.
a second. The blonde
Um,
hair's still here, still around.
we were always together and we're genetically identical, and our experiences were almost identical, and so I think that breeds this intense closeness and understanding and
Hmm.
empathy that you could never experience ever again in your entire life.
Hmm.
So I think our brains work the same way, in a lot
Yeah.
of ways, and so some of it's just thinking the same thing, or we definitely would talk at the same time, just kind of on accident. We weren't like those.
Yeah.
Maybe we could try it like those Australian twins. Amber, can you talk with me? And what am I going to say? We could. Can you try it?
Not from there anymore.
So some of it's just kind of having that same experience, that same, way of thinking that that's easy. And so maybe, but there are weird things like I half expected her to come on wearing the same shirt that I was,
Yeah.
or we always order the same meal at a restaurant, even
Yeah,
if
we
we're
would.
sitting across the way. Things like that are kind of uncanny.
Yeah.
I think something people don't realize too, and this is probably, any twins, but in addition to the DNA and just the special connection for identical twins, is also like if you have siblings, your parents are even different. But, our parents parented very differently with us as the oldest as they did our youngest 12
Hmm.
years later. The teachers at school, even if you have the same teachers, like they're at a different stage. So everything was the exact same stage. Our siblings were in the same stage interacting with us, our friends, our social scene was the same, which is just so unique. But I also always wonder what's it like not having a twin.
Right. Yeah.
We
I don't
kind
know.
of
I
know
don't know what
more
that's like.
now. It's weird where that was like our whole identity. The Jackson twins, Erin and Amber and Erin. That was like our whole life
Yeah.
through like, graduation. And now it's like, you're a twin? How come you didn't tell me? And people get like mad and you're like, it felt weird to be like, hi, I'm Erin, I'm a twin.
Yeah.
So it's weird that was my whole identity before and now it's not. And sometimes that's kind of hard to reconcile. And people will be like, where's Amber? And I'll be like, what do you mean? She lives in Utah. I'm in Illinois. What do you mean, where's Amber? How would I know?
Yeah.
Where do you think she is?
Maybe at the grocery store? I don't know,
Right. I'm like, I don't know. So it's funny. What are the kind of funny, annoying things that people say to twins, Amber?
I always used to get bothered by the expectation that a twin is like a slave or a robot. I wish I had a twin because then she would take all my tests for me that I didn't want to take. Blah, blah. Why would I want to take my sister's math test?
Someone said that to me 2 days ago.
Oh,
They're like,
really?
oh,
I
you're
haven't
a
heard that in
twin?
decades.
I would love to be a twin. It'd be so interesting to have another me running around. That's what they always say. I'd love to have another me running around. I'm like, I don't have another me running around. I have another person that happens to look a lot like me, but I'm not like confused when I look at her and I'm like, there I am. Sometimes I look at pictures and I'm confused if it's me or her. But most of the time, I don't think we look that much alike. Funny enough, but it's funny that people just assume I'm like, I have my own math test to take. Why would I take hers? But I guess there are enough people that do trade and do pranks like that. But also, I'm an honest person, and it's actually still cheating if your twin does it for you. So
yeah, I think there's a lot of lack of recognition of individuality. For so long, I was trying to prove I'm more than half a person.
Yeah.
And I'm very similar. We were very similar. So I get people having a hard time distinguish us because even personality wise and our interests, we were very similar. And I've grown more different as we've lived far away from each other. But just the trying to just prove, hey, I'm a real person. People would say, oh, hi, Erin. I'd say, oh, actually, it's Amber. And they'd be like, same thing.
Same diff. Yeah, they'd say that.
And that's just, it's hurtful.
Yeah.
But
I think
I
it's
do think
interesting
that's the
because
hardest part.
yeah, that's weird. Like that's very strange to me.
Like,
I think
not
being
same
like a
thing.
younger sibling has similar things about it. Because like, oh, you're so and so's sister. Oh, do you also do blah blah blah? And you're like, no, or yeah, because she does that, and so then that's what the rest of us have to do too. It's a very interesting dynamic. Just the family dynamic.
Well, and I will say too, we are pretty high achieving, and so we never won awards because you have
they
to
didn't want to give one.
choose. There's one for the 6th grade, Hope of America. I think I would have won, and they'd tell you we didn't know who to give it to, so sorry.
Yeah. Oh, that's
We
so
couldn't
interesting.
choose, and we're so non-competitive with each other that we were very much like, I wish you would have just chose one of us.
Right.
I know you're trying not to make it a thing between us, but one of us that's kind of acknowledging both of us in a way. And if I did win something and she didn't, I would rather if she won it. It would hurt my heart so much.
Bad. Yeah.
People would say, you're the pretty twin. And I'd be like, don't say that to me. I don't want to be the pretty twin.
Yeah.
don't say
What a
that
weird
about my
thing.
sister, you know?
Yeah.
So
Weird
Hey, no one ever
thing.
said I was the pretty twin. I'm starting to realize some things here.
that's not true. If you told me you were smart enough to realize that when your friends told you that they were my friends were probably telling me that, and I was like, "Oh, I'm just egotistical or something." I didn't figure
I'm
that
just
out.
kidding.
That's
Or
I'm
the
just
other
kidding.
thing is they line you up and they go, "Okay,
Oh,
you
yeah.
you have like the squinty mad eyes and you've got like the horse teeth and you like
You
they're
have the
just
fat
trying
face.
to like sink it down in there, but they don't say it in a nice way. It's really
You're like, don't say that out loud.
Yeah. You're like, that's why I wear a pink bow and I wear a blue bow. Okay. Just
I think there's a lot of dehumanization of twins, and that probably sounds
weird.
really weird, but they just don't see you as a full, like their brains can't comprehend it. And so they
Yeah.
don't
Yeah.
see you as like a full person. And we were so identical. One hand could count people that could tell us apart
Yeah.
by the time we graduated high school. So
To be
that
fair,
makes it more
maybe two
challenging.
hands, maybe 10
Yeah.
hands.
Maybe two,
That's crazy.
maybe half a second hand. If you're one of those people, you know who you are.
Love that.
Well, thank you so much for joining us, Amber. I think it was really fun talking to you.
Yeah. I'd love to dive deeper into this. You talked about also like healthy coping strategies and things like that. And I'm like, oh my gosh. There's just so many ways to apply emotional intelligence to your day-to-day life
Yeah.
just through just the superficial brush that we just put over it.
Yeah,
There's just so much
definitely.
more. It's incredible. I gotta do.
Amber, is there a place if people have questions or could use your expertise that they could reach you? Would you be willing to talk to people? I know at
Yeah.
some point in your career you were doing like resume coaching and prepping for jobs and interviews and things like that. Are you still willing to do some of that if people are interested in chatting with you?
Oh, absolutely. Probably the best way to reach me is through email. And so that would be Amber Collins, COLLINS .PhD@gmail.com.
Great. We'll put
Awesome.
that in the show notes too. Thanks so much again. And thanks for catching another episode of The Resting Stitch Face.
I'll see you soon.
Thanks for including me.
Thanks for listening to another episode of The Resting Stitch Face. If today's conversation spoke to you, imagine what it would feel like to connect in person. That's exactly why we created The Doctor Is All In, a retreat just for women in oral surgery. Learn more and grab your spot at thedoctorisallin.org. We'll see you next time.